Joanne, you're live and local with Dr. Chambers on KABC. How are you?
Hi, doctor. I'm fine. How are you doing?
What's going on?
I had a recent diagnosis from my doctor of adult attention deficit disorder.
Mm-hmm.
And I think I've probably had it for a long time. It seems like the diagnosis fits. But he wants to prescribe for me Adderall. And several people in my family had some real strong kickback to that I shouldn't take something like that.
Well, what do you mean by strong kickbacks? What did they have side effects?
No, for instance, somebody in my family that's pretty health conscious and into healthy lifestyles said, this is a drug like speed. You don't want to take something like that. It's, that's going to be really bad for you. You should try to control it with lifestyle and health choices.
Okay. But tell us, Joanne, what symptoms were you having that you went to your doctor and said, I might have this disorder?
I have a lot of problems with starting something. Like maybe I'll be in the kitchen doing the dishes, and I'll walk to another room to get a dish, and I'll notice the bed's not made, and I'll make the bed and forget to do the dishes. Or just things that in my work where I'll have something to do and something else will pop up, and I'll forget that I'm supposed to do the first thing, and I have a lot of trouble concentrating.
And what is your job?
Sales and marketing.
Sales. So are you looking at spreadsheets? You're looking at a computer screen a lot?
Yes.
Okay. And why has it reached critical mass now? Why'd you go to the doctor now and not a year ago or 5 years ago?
Because somebody who works with me in my business suggested to me that they could see this problem that I was having with concentration and staying on task, and they said, they had the same problem, but they had been diagnosed with adult attention deficit disorder, but were unable to take drugs for it because they had a heart problem.
Yeah.
But he said, I see the same symptoms in you, and you really should check it out because you could be a lot more effective if you could just get your brain to calm down.
Well, see, there's three features, Joanne, to ADHD. Inattention, and you seem to have a little bit of that. And then are you hyperactive? Are you fidgeting a lot? Unable to remain seated when you should and all that?
I do move around a lot, yes.
Are you impulsive?
I'm sorry?
Do you think you're impulsive? Would you blurt out an answer before the question is finished?
Yes, I do that.
The fact is that a lot of us, I have some of the same things you have. I might get distracted and start not finish, want to do something else and stuff like that. The question you have to ask yourself is it pathologic? Is it really interfering with my life? And if it's really interfering with your life, then what can I do about it? Now, I'm not that fond of Adderall. And Adderall is, in a simplistic way, is a form of speed, right? That's a fact. And as you get older, if you're going to have a heart issue, Adderall could be a problem. Now, Adderall is safely used in adults. Please, Mr. Adderall, don't come start sending me emails, suing me. I know a lot of adults do it. But I'm inclined to think that this diagnosis these days, Joanne, is overused. And I'm skeptical about people who are like mature adults who've got a good job where this is a big problem. And I tend to suggest that you go into lifestyle changes. And I tend to suggest looking at therapy to see, can you control those aspects of your life? And then I would do the lifestyle stuff for 6 months, the therapy stuff for 6 months, and say to myself, has it improved my life? And is my life not going so well that maybe I'll try Adderall for 3 to 6 months and see if it makes a big difference? So that's the way I would approach it. Lifestyle first. Don't get to where I want to go. Then I would take some Adderall and see. But I would kind of keep a record because it's awfully hard to say, has it made a big difference? So I tend to suggest to people, write a little diary and say, this week I'm making this lifestyle change. And at the end of the week, kind of record, has it made a difference? Do that over the course of a period for the lifestyle changes and do it again if you decide to take the Adderall. But I also would go and get a second opinion from another doctor, or I would see a specialist, maybe a psychiatrist or a psychologist, and see if they agree with the diagnosis of ADHD before I would launch myself into Adderall. I would strongly encourage you to do that.